Thank you very much for joining our webinar tonight on medical cannabis patient stories. It's a really interesting area where we feature some first-hand accounts of patients and carers about their journeys with medicinal cannabis. And we feature 5 people with various conditions, including autism, epilepsy, chronic pain, MS, and cancer, telling us about their experiences. And these patient stories are really important in winning hearts and minds amongst other health professionals and also some of the regulators as well. And anyone who was a skeptic before, I'd challenge you to listen to some of these stories and still feel the same way. And it ain't going to happen because these are people that live 24/7 with their pain or the person they're caring for in pain. And in some cases, this is improving quality of life. But it's also important to tell these stories, to research that there's some great research going on in Australia, and a lot of this is based on patient first-hand accounts. It might have to go back to preclinical studies on rats, but eventually it comes at full circles, and hopefully they will improve quality of life by producing medicines that can help patient outcomes. And we discussed a lot of that research in our last webinar, which is available now on YouTube. But first, a big disclaimer from me: if anyone is considering medical cannabis as a treatment option, do not take anything said tonight as advice. It is purely for informational purposes only. That if you do have a medical condition, please consult with your medical practitioner about your personal condition and get some advice from your doctor or other qualified health professional. Now, there'll be plenty of time at the end for questions from all the participants, and we're doing a panel-style Q&A at the end. But at the end of each presentation, then some of the panelists will be available for a Q&A, but please do use the Q&A function, not the chat function. We won't be answering any questions from the chat function. The Q&A is where you answer, you put all the questions. And we'll be doing live questions from the participants at the end where we ask them to, you'll see their faces. So on to our first speaker. I'm just going to share my screen.
Hi Paul, how are you going?
Good, thanks.
That's good, thanks for having me.
Please tell us your story and your experiences with the dark side that is medical cannabis.
No worries. I'll just give you a bit of background on Soph and then I'll kind of lead into her story. So Soph is she's nearly 12. She was born with a genetic epilepsy disease. It took us quite a few years to determine exactly what it was, but she has been diagnosed when she was around about 4 with Dravet syndrome, and its medical name is severe myoclonic epilepsy of infancy, and it's a catastrophic form of epilepsy and drug resistant. So that's sort of her condition. She's also, a part of that, has cerebral palsy. She's non-verbal. You know, she has a multitude of disability that all come under that Dravet syndrome diagnosis. We have tried absolutely every possible drug available to try for Sophie, and nothing was ever really significantly helpful. Some drugs in the past would...
Sorry, Shirley, exactly how many drugs have you tried? I really like you to quote the number for some of them.
I actually couldn't tell you the number of drugs, but I would say how about I put it this way? You're a pharmacist, so you know how many drugs. The only drugs we haven't tried is lamotrigine, and that's about it from an epilepsy drug point of view. So I don't know, how many is that? 30 different drugs?
Well, there's about 10 common ones and about 10 semi-experimental ones, and that's what I hear from a lot of patients with Dravet is they've tried all these things, and nothing has worked. They're still having multiple seizures every day, and I like people to tell their stories firsthand. That's why I'm webinar.
I mean, it's Sophie, at one point she was on a daily dose of ketamine to try and control her seizures. I mean, like, her seizures are, her condition is really severe. we tried everything, and nothing was working, and she took a bit of a massive decline back in 2017. She's had, we stopped counting at about 100 times that she's been intubated for her seizure, because of her seizures. And because of that, her lungs have never really properly developed. And she's had acquired many times she's had, ventilation-induced pneumonia. And then she's got hospital-acquired bugs pneumonia, which is impacting. So now she's also developed chronic obstructive pulmonary disease, which we have to manage now on top of her epilepsy syndrome. So back in 2017, her lung problems became a real issue, and then it threw everything out of control. We had no more drugs to try at that time. We tried absolutely everything. And we then sat down and had discussions about where Sophie was at. So she became palliative care at that point. And we also had to then sit down and have discussions around her do not resuscitate orders, which was just insanely hard. Sitting there having to have a conversation about your daughter and should she not recover, or should her lungs progress to a point where they can't intubate her anymore, they're not going to. So that was really full on, and we've been pushing to try medical cannabis for about 3 or 4 years prior to this point, and our neurologist was all for it. However, she suggested that she was working very hard also behind the scenes to try and get it available for some of her kids here in WA, in Australia in general. And she just said, it's coming. And we just kept pushing and hoping that it would happen. And it still hadn't happened by the time we were at this point with Sophie going into palliative care. So we just said at that point, we have a bottle. The product was called Haley's Hope that I researched quite significantly and found that one had a lot of information available in how to dose and what the compounds were and all of that. So we bought some, and I told the doctors at that point, I'm putting her onto this because you're telling us that we've got no more choices. So I'm just going to do it. And while it was off the record, both Sophie's palliative care doctor and her neurologist were very supportive of it. And basically, we left hospital after being there for 7 weeks, and going home with who to call should Sophie pass away during the night. So we started this, and she didn't get better, but she stabilised. Everything just stabilised, and we hadn't had that for like 3 months. And then after about a month of being on this Haley's Hope stuff, we actually noticed that she started to get better. Like her lungs started to clear up. This inflammation, the bronchitis started to clear up. And then it was quite phenomenal. And during this period, it was at the final stages with the Australian government about getting medical cannabis accessible. And during this time, we were still pushing really hard. And then we actually did an interview with the ABC 7:30 report. And then sort of a few days after that, we finally got our prescription for cannabis through the Children's Hospital.
Not mentioning any brands too, by the way.
Pardon?
We're not mentioning any brands.
Sorry, yeah, I won't mention that brand. Sorry, but yeah, so we got that in August of 2017. And then Sophie, it took us a long time to get the dosing right because there's not really any guidelines, and what the information, I guess, from the company that the hospital are buying it from, they've got guidelines to what they suggest is a therapeutic level, which is quite a significant dose, we just we can't get Sophie anywhere near that. It just makes her too sleepy. And because of all the other medicine that she's on, it interferes, because they all use the same pathway in the liver to metabolize and all of that. We have to be really mindful of that issue. So It took us about 2.5 years to get the dosing right, but in that time, Sophie's seizures really settled down. Her quality of life improved, and to the point that we could get her back to school. Seizures didn't stop at all. Sophie's seizures won't ever stop no matter what we do. That's just part of her illness, but it's about her, we work on her quality of life. That's what we focus on. So this time last year, her lung problem split up again. Winter's a really bad time for all children that are unwell, with all the bugs around. So she spent a few months in hospital last year, but she wasn't to the point where she was deteriorating. She just kept picking up, you know, she got the flu and then she picked up another bug, you know, just random, or should I say, just usual winter stuff. And we then introduced another anti-epileptic into the mix at that point, which she had been on before, and we really resisted going back onto it again. But we needed to put her on another medicine because there was just something missing in her cocktail. And almost immediately that drug was helpful. And she just went from having seizures. So when the cannabis started, we went from having big tonic-clonic seizures almost every day to just having little absent seizures. And she was having them every sort of 10 to 20 seconds all day. But compared to that being the tonic-clonic every hour or so, it was a huge noticeable difference. And then starting the sodium valproate up again, with the combination of our other drugs and the cannabis, we just found an absolute miracle, if you like, that it's just stopped everything. So she rarely has any seizures now.
Wow.
And the doctors often ask me, oh, you know, is it that because we introduced the sodium valproate, is it that doing it? And I know, because we've been through all of this before and we've been on the valproate before, that yes, it's helpful, but without the cannabis, it wouldn't be working, and none of the other medicines would be working as well as they are without the cannabis oil. And consequently, we've been able to reduce her pharmaceutical drugs down to their minimum therapeutic level so that she's not so toxic. And then when she does have big seizures, which require her to go to hospital because they have to load her up with drugs, which causes her ammonia levels to increase, we just have to, that's just what happens now, but it only ever happens in a hospital setting. But because her regular medications have been reduced so significantly, we don't have any of that problem during her, you know, her well periods. We know that without her being on the cannabis oil, she would not be here, Paul, if we hadn't started her on the cannabis 3 years ago, nearly 4 years ago. Yeah, it's really, really changed her life, and you know, we still have our daughter because of it.
That's great. I remember when I first met you were saying she was on, you know, palliative care, and recently I asked you to speak at a medical seminar for health professionals to tell your story, because I can quote the science till I'm blue in the face. And I was really happy that you couldn't make it because you had a fantastic reason. If you'd like to share that with everyone.
Yeah, absolutely. So Sophie is in year 6 this year at her primary school, and the year 6s always have a school camp, and it's a really big deal because Sophie goes to a mainstream primary school with the education support unit within it, and it's a really inclusive school. It's just beautiful, and they make a really big deal about the Sienna kids, making sure that they can go on camp, be with their peers to enjoy the experience of year 6 camp. So we were planning it from the end of last year, and we sort of had to make sure that all bases were covered in regards to, you know, for an emergency situation, we had to make sure that everyone was aware, and we even spoken to St John's and the local ambulance depot and everything. Thankfully, none of that was an issue, but Sophie made it through the whole week, and she absolutely had the most amazing time of her little life. So much so that all of us teachers and the parents that were there, we were just all in tears at the end because we were so happy that not just Soph, but you know, all of her friends and her Sienna friends all got the experience. But for us, because Sophie, you know, she'd only been in hospital a couple of weeks before with a chest infection, so and we'd hoped and we'd planned for her maybe making it through one night and maybe 2 days. And that's kind of, if we got to that, then that would be brilliant. And the fact that she kept pushing herself to make it to the end of the week, and she had the most amazing time. Just brilliant, just brilliant. Yeah.
What a great story. Now, thank you so much for sharing with us and telling us your story here today. Really appreciate it. Thank you.
Thanks, Paul. Thanks for the time.
Hi, I'm Jason, and thanks very much for the opportunity to share, I guess, all of the things that I've learned over the last few years. This is a shortened presentation compared to what I normally do. I'll keep it as brief as I possibly can, but look, I'm more than happy for anybody who is interested in this to contact me afterwards, and I'll provide some details on how to do that. Now, I can share with you exactly the benefits and everything that I've had from medical cannabis. So let's get this thing underway. I'm going to press this button. Ooh, look, there I am. I'm squeezed down into the bottom of the actual picture. My name's Jason, Jason Jordan. I am now a medical cannabis advocate, a patient advocate, if you want, because I have seen the benefits firsthand. I've been on it now for some 2 years, maybe over 2 years. And the benefits to me have just been extraordinary. So, look, the difficulty when it comes to things like medical cannabis is that there is such a stigma around it. And my experience to date has been that it is not dangerous at all. I've had no tangible side effects whatsoever. And that's a really good thing, because when it comes to multiple sclerosis, which is the condition that I've got, there really isn't a lot of treatment for it, even when it comes to the symptoms, because with multiple sclerosis, the symptoms are different in almost every single person. It means that the conventional treatments for it are really, really difficult. And that's where medical cannabis is so beneficial, because it's the sort of drug that you can't overdose on, that can't do you any damage or any harm. There are some exceptions to that. I'm sure other people will touch on that. If you already have a predisposition towards mental illness of some kinds, you'd probably steer clear. But under medical supervision, the benefits might outweigh those risks. So you can see some pictures below of some of the treatments that I have. One of the medicines that I take on a regular basis, every 6 months, I have an infusion of something called Ocrevus. And Ocrevus, wonderful medication, it slows down the progression of multiple sclerosis, which is a good thing. Unfortunately, there's no such thing as a cure. So what I'm really looking for at the moment is something that can treat the symptoms that come about as a result of the damage that's actually done inside my brain. So it's not a good place to be, but hey, it is what it is. I'm 48 years old now. When I look back at my medical record, I can see that I probably had MS as far back as the age of 20, 21, but it really only hit me in the last 5 or 6 years. Well, maybe a little longer, maybe 7 or 8 years. The problem is I've got a very specific personality type. I'm quite out there. I'm often brash, but confident. And so with that type of personality, to start being hit with any kind of disability is actually a pretty scary thing. Now, as you can see on the slide there, until 5 or 6 years ago, I was CEO of a rather large technology organization. But what I found is that because of the symptoms of MS, and not just the standard symptoms like limping or paralysis in your face or something like that, it actually affected me cognitively as well. And I started losing my memory, and it was difficult for me to find my words. There were lots and lots of symptoms that meant that it was making very, very difficult for me to actually do my job. And so, unfortunately, the way I look at it is that MS took my business away from me. We had to sell it, and that it was devastating, because something that I built from scratch suddenly had to be sold in what was effectively a fire sale. So let's talk about medical cannabis. I said before, it's not a particularly dangerous drug, and this slide I think is a good example of why it's not dangerous in comparison to all of the other medicines that are available. And I'm including things like, your bog standard paracetamol. That's dangerous, and people don't realise it. If you were to take a full packet of paracetamol bought over the counter or your local IGA, you would probably end up in hospital dying from painful liver failure. But if I took a full bottle of medical cannabis, I'd just get the munchies. And so it's kind of hard. You know, when you balance these things up, it's very difficult for me to tell anybody that it's a dangerous drug. It's just not. That's the bottom line. All right, medical cannabis. Drugs are bad, okay? I've just got to put that in context. The thing you've got to keep in mind is that it acts differently for everyone. Now, in the example of headaches, if I take 2 paracetamol when I've got a headache, the headache goes away. If my wife takes 2 paracetamol, it doesn't do a damn thing because her type of headache is a different type of headache. And the same goes for things like multiple sclerosis or any other medical condition that you've got. It might work for me, it might not work for you. And there's a whole bunch of factors involved. And it includes things like body weight and whether or not you've used cannabis before, what you've been eating that day. There's a whole bunch of different things that can affect how the cannabis reacts in your particular body. As my MS developed, there's a picture of me there with my walking stick at the time. I don't need my walking stick anymore. And in fact, on the EDSS scale, which is a measure of how disabled someone is, I managed to get to 6.5, which meant I was just shy of going into a wheelchair. Now, nobody wants to be there. It's a terrible, terrible place to be. As you know, it's obvious to everyone, if you're in a wheelchair, you are disabled. And that might not be the image that you've got of yourself. And it's scary. It leads to depression, it leads to a whole bunch of different things. And simply because you've got all of these deficits here, you're expected to take all these different medicines. And in fact, I was on 7 different daily medications. And since I've been put onto medical cannabis, I'm down to 1 daily medication, which is called Cifrol. It's a Parkinson's medication. And it's because I get the shakes. As of about 8 p.m. of every evening, I start to shake a little bit. The medical cannabis does nothing for that. And there are certain things that medical cannabis will do nothing for. Let me just briefly touch on this idea that a lot of people are putting out there at the moment that it cures cancer. I think that's a very dangerous claim to make, and a lot more research has to be done. There are certainly people I know of who claim to have had some fantastic results, and I've seen the formal acknowledgement of those results coming from, for example, a radiological clinic who's been scanning them regularly, finding that the cancers have reduced and in this particular instance disappeared altogether. So there is some evidence to say that it might help, but you certainly don't want to, hook your wagon up to that particular horse and hope that it will. The other really important thing is to make sure that if you're on any kind of medication at the moment, particularly when it comes to cancer, that you continue that medication. The medical cannabis, in the beginning at the very least, should be an adjunct to that. It should be something additional, not something that you use to completely replace your anti-cancer medication. Madness, isn't it? But I thought I'd include a complete list of the serious side effects of medical cannabis. As you can see, there's really not a lot. In fact, I don't know, maybe dizziness. If you take a little bit too much oil, maybe it's not pleasant when it comes out the other end. But there really isn't a lot of side effects. So here's the touchy-feely bit. I'll get through this pretty quickly. Medical cannabis took me from being disabled back to being the dad that I want to be, which is fantastic. And whilst I really want to be the dad that I want to be for my kids, also super, super important is being the husband that my wife married. And look, she would stand through me through thick and thin. There was absolutely no doubt that she would stick with me. But if I have the ability to not be disabled, if I can do something to make it so that I'm the man that she married, rather than her having to become my carer, then I'm absolutely going to do that. There's nothing wrong with being disabled. But if you have a choice in the matter, which way would you go? Ultimately, what it's done is it's brought me back to be the person that I think I am. You look in the mirror, you look and go, yeah, that's me, that's what I am. Once you get disabled, particularly if you've got facial paralysis or drooling or whatever else, which is where I was at, I'd look in the mirror and I just did not recognize who I was looking at. So it affects you psychologically as well. So in this instance, the medical cannabis has not only benefited me in terms of fixing a whole bunch of my symptoms, but because it's brought me back to being as normal as I can be, it's improved my mood and my spirit, and it's made me a nicer person to be around as well. Alrighty, anybody know who that is? Yes, that's James Brown. And normally I would have a little bit of audio that I would play, which is what you know James Brown is famous for. And what does he normally say? He says, I feel good. Yeah. And look, I do feel good. But that's not really what this is about. It's feeling good's great. But the important thing, I guess the real takeaway from this whole presentation is not that I feel good. It's that I feel much less bad. And I really do. You know, taking all those drugs, taking the opiates, was constantly putting my head in the clouds. Lyrica, oh my goodness, that is not a good medication. Anyway, these days I'm feeling a heap better, and I don't have to take all of those different medications, and that makes an absolute world of difference. What I would like from you, I'm not going to ask for your money or donations or anything, although that would be good, but no, we're not going to ask for that. What we want is for you to talk to your doctor. And if your doctor is not up for this, then find another doctor. I mean, if you took your car to a mechanic and the mechanic said, oh, look, I'm sorry, no, I can't, I'm not going to do the radiator, you'd go to another mechanic. You've got to do the same thing with your doctor. And if you've got a doctor who is not educated or progressive enough to understand that this is an amazing medicine, then you need to find yourself another doctor. Now, at MCRA, if you talk to us, we can probably refer you to some doctors who are more sympathetic to this kind of thing. But the bottom line is, if we want things to change, we've got to make them change. It's not going to change on their own. So when we say you must be the change you wish to see in the world, it's up to us and it's up to you to make sure that the word is out there and that we reduce the stigma and that we normalise the idea of using cannabis as a medical tool. I know what difference it's made to me, and that's why I now volunteer so much of my time to MCRA. I'm Jason. Thank you for hearing my story. If you want to get in contact with me, you can do so via Twitter or just get in contact with MCRA, and I'd be more than happy to have a chat with you. Thanks very much for listening.
I'm here with Anna, who is a medical cannabis patient. She's going to be telling her story today. And she suffers from trigeminal neuralgia and meningioma. Hi, Anna. How are you?
Good, thanks.
Yeah, I just want you to tell your story about your journey with medicinal cannabis and what you've been taking and how it may have helped you.
Yeah, it definitely has helped me. The hospital wanted to put me on lignocaine, so I wanted to trial medical cannabis. It was hard to find that GP or the doctor who could prescribe it. I found him. And I started off low and slowly, and in the beginning I didn't feel it helped. I didn't really feel a lot, but then it started to, I could see, oh, it's good. And I've managed to reduce all of, or most of my gabapentin and all the other hard drugs I was on. And now I only have 120 during the day. I've got 9 mil. I take 3 mil 3 times a day. And then at night I use half. And I take 5 mil at that one.
So what was the pain like before you started taking medicinal cannabis? And can you give me an idea of what other medications you were taking? How many you said you reduced them? What other things were you taking apart from the gabapentin?
Oh, the gabapentin, I was on 3,600 milligrams a day, and I've been on that for a long time. Endone, I took endone as well at night, sometimes during the day. Panadol, always been on 8 Panadols a day since I started this journey. And I'm on some, I can't remember all the other stuff I was on, but now I'm reduced down to only the gabapentin. And after my last surgery, 30th of March, I now take Panadol again, but I will start reducing Panadol and the gabapentin as well.
And what sort of pain level were you in prior to taking?
10. 10 out of 10. Like trigeminal, it's like someone stabs you with a knife, constantly stepping around with a knife and screwing a bit, and it's terrible.
Was it hard to sleep?
Pardon?
Was it hard to sleep?
Oh yes, absolutely. I've had many sleepless nights where the pain just has constantly been there. Yeah, it definitely works.
And what's been the improvements to your quality of life with medicinal cannabis? What symptoms has it helped with?
The pain has gone, the severe pain. I can still feel sometimes in between small tingles, but I can, the wind, aircon, lots of things trigger, but also when I'm close to getting my medication or my oil, because I've spaced it out in between each other.
And have you had any side effects from medicinal cannabis?
No, not at all. Not at all. Yeah, not at all. Only a mistake. I double dosed a night dose. I took it early, and then again when my alarm went off and the hospital said I had taken it, so I felt a bit woozy, but I was in my bed, so it was all good. Next day I felt good again.
Yeah. And has it had any positive effects on your appetite? And you said it helped you sleep. Can you talk about that?
No, I sleep very well, and appetite. I have put on a lot of weight, but I believe it's the medication. I was on a lot of dexamethasone for a long time.
Yeah.
I believe that's that. I don't think that's the oil.
Excellent. So have you had any interesting reactions from your friends and family? What have they thought about you using medicinal cannabis? Is that something you've discussed with them?
Yeah, I've discussed with them all. They sometimes new people, you're a druggo, but it's medicine. It's my medication, and I'm not afraid to talk. Yeah, as my husband used to say, they can see I'm getting better. So
excellent.
I can do things.
Yeah, excellent. Thank you so much for sharing your story. Really appreciate it, and look forward to hopefully you answering some questions from our audience later on. Thank you.
Thank you very much.
I'm here with Bert. He's not actually a patient. He's a father of an autistic child, and he's here to tell a story. Hi, Bert.
Hi, Paul. How you going? Yes, I can start. Our journey starts about 16 years ago. Our son Taylor is 18 years old now, and after the age of about 18, 20 months, we noticed something wasn't right, and we took him to a paediatrician who confirmed to us, or actually told us that she suspected that he had autism. After some more tests were done through a panel, her suspicions were confirmed, and so we were told that our son had autism. We didn't know too much about it at the time. This is going back more than 16 years. Didn't know too much about it. Maybe a little bit of what we heard on TV or whatever, but now I guess it's more out there, it's in everyone's face, so it's more knowledgeable. Initially, it took us some time to try and absorb the information that the doctors were giving, a little bit of grief, and after that we got on with it and tried to do what we could to make his life fulfilling. At the age of about 3 or 4, we noticed that his anxiety and behaviour was just escalating just a little bit. He's by nature not a child with a lot of violent or any violent tendencies, but he does have behavioural issues. He did have them back then as well. Way less back then than now. So another paediatrician that we went to suggested that we should put him on a very small dose of risperidone. So after researching a little bit about that and asking another pharmacist friend, he told me that, this is a very small dose. There's not going to be too many long-term side effects at, a dosage of this amount. So we started on the risperidone. And so as he got older and his weight got heavier, the dosage that he was on wasn't enough. So the risperidone dose was being increased. A few years later, we introduced another medication, which was Epilepsy, because the risperidone wasn't working by itself. And this went on for a few years, and before we knew it, he was up to 4 medications, all prescribed by the paediatrician, and the dosage was just getting higher and higher as he got older and his weight was heavier, and I guess maybe his body built up some tolerance along the way to these chemical medications. And so this just went on, and it's always been a worry for us. It always was a worry, but we didn't know where to go, what to do, and so we just carried on until we found out, what other alternatives there were. At age 15 and a half, all of those 4 medications weren't working anymore, or weren't working properly anyway. They didn't have the effect that they used to. So, and I didn't want to increase the dosage anymore because, we'd gone from a small dose medication to 4 medications of fairly high doses, of which weren't working properly anymore. I found out about this medicinal cannabis that I'd seen on TV, saw it on 60 Minutes, watched the news. It was a little bit on YouTube, I think, and so I decided to look into that, and we introduced this to him, and within a short space of time, his anxiety and behavioural issues started to calm down a little bit. Another issue that he's also had, which would make his drugs go to 5, is he's got chronic sleep issues. Or he's had chronic sleep issues, and he was also taking melatonin for sleep. So just to give you an idea, 6 tablets of 2 milligram melatonin, which is 12 milligrams a night.
That's a really high dose, but yeah,
very high dose.
I'm aware that a lot of kids with autism have the comorbidity of having insomnia. They just simply can't sleep, and they don't function that well.
Yep. And that 12 milligrams wasn't working either. So he's now 18, and he's transitioned out of Perth Children's Hospital to an adult hospital. So now he's seen by a doctor at that adult hospital who just wanted to carry on with the chemical medication, and by his admission, he admitted that that our son had very complex issues, and at first he thought he could overcome them, and then he realised it wasn't as easy as he thought. And so we've carried on our journey with the medicinal cannabis, and we have been along the way, trying to see how we could wean him off the other drugs. And as of recently, he's now only down to one of those drugs. He's come off 3 of those other chemical drugs, thanks to medicinal cannabis. It sounds like I'm working for a company here, but I'm not. So his behaviour is so much better. His anxiety is so much better. We've now fine-tuned what we give him, and we have a daytime ratio and a nighttime ratio. So the nighttime one is for sleep, and the daytime one is just so you can get along during the day and operate during the day. So we fine-tuned it, and like I said, he's reduced 3 other medications. He still takes a tiny amount of melatonin, which is now down to about a 2 milligram tablet, gone down from 6 of them down to 1 now. That's just to ensure that he will get to sleep at night. His doctor at the hospital was actually surprised and a little bit dumbfounded, and because initially when he did come up, when we did go across to him from Perth Children's Hospital, he used the word alternative as a medication for medicinal cannabis. But I explained to him this is not an alternative, it is an actual option. And as a parent, I believe we have an option to use this, not as an alternative therapy, but as an optional drug. So this is where I think doctors in time will come out of thinking that it's an alternative, and it is actually an option. A lot of the doctors are now saying that. So it's very important that you do speak to your doctor about options, not just alternatives. So we're very happy at the moment. So we've fine-tuned it in time with the doctor's advice. That is, we'll try and wean him off that last medication, or at least reduce it, and carry on our journey. So, it's early days now. So he's a lot better now than he was when he first started on the medicinal cannabis. His anxiety, his behaviour, his sleep patterns are a lot better, and he can live a more fulfilling, a more normal life. So there you have it. If you don't know, ask around, do what we did. Jump on the internet. There's tons of resources you can look at. Ask Paul. He can help you. He can talk to you. So there's a lot of...
Ask your doctor. And saying that, it's actually, you're quite lucky that Talon's turned 18, because under 18, quite often you need specialist sign-off, but over 18 in most states now, not all, most states a GP can prescribe.
Yep.
Sometimes with specialist sign-off, but prescribing has been a whole lot easier lately.
Yeah. And it's not just for autism as well. So, I mean, there's chronic pain and that sort of thing. So, the more I talk about it, the more people are nodding their head and saying, yeah, and we use it for this and we use it for that. And, I've started using it for this, or chronic pain. A lady that I know who said that she couldn't sleep, pain was just too much. And then she started on this, and it's now almost gone away, and she operates almost normally now for chronic pain. So, look, there's a million uses which I don't, know the benefits of, but, they're out there, I believe. So, but as far as autism goes, I can just tell you what it's done for us and for our son as well. So,
but there's 2 autism studies that I'm aware of that are happening in Australia that it's interesting because they're backfilling some of the patient experiences into these clinical trials, but you've seen firsthand like a change in Talon as opposed to other medications.
Yeah, absolutely. And I think what we also forget, a lot of people forget, is that a child or an adolescent with autism isn't the only one that suffers. The whole family suffers. So what price do you put on, a better quality of life for that child and for his family or her family, like brothers and sisters, mum and dad? So what price do you put on that? So people forget about that all the time. Experts and specialists forget about that all the time. They just focus on that one person or that one child that's got autism, but don't really know how much the others in the family are suffering. So the sooner that you reduce the suffering of that child, the sooner the family suffers less, and it's win-win for everyone. It's a good day for everyone.
Yeah, no, definitely. No, there's more than one person involved. So you mentioned earlier on you wanted to give a shout out to some people in Melbourne.
Yes, I did. Yeah, I forgot all about that, didn't I? Well, didn't forget, but yeah, just got into it. Our hearts go out to fellow Australians in Melbourne and Sydney to an extent. They'd be really struggling, and I tell you, who'd be struggling the most would be families with kids with autism that'll be stuck in houses, in apartments, in homes, not being able to move, not being able to do their daily routine. It would be very, very tough for them. And we're very blessed here in Perth that we're not going through that. But I know that, the folk in Melbourne would really be struggling, especially those families, with kids with disabilities. They'd really be struggling because their daily routine's just upside down now. And our heart goes out to them. So hopefully this goes away very soon.
Thanks very much. Great chatting with you, Bert. Appreciate it.
All right. Cheers. Thank you.
I'm here with Leslie. She's a medical cannabis patient and she's going to be telling a story. Hi, Leslie.
Hi, Paul. Hello, everybody. My story starts back in February 2015. I was first diagnosed with an ovarian cyst on my left ovary. That got upgraded to stage 4 uterine cancer. I started chemo back in February the 13th, and I had 6 rounds of chemo with 2 rounds concurrent, 30 rounds of radiation, which was supposed to be extra preventative treatment. By April 2017, my cancer had come back everywhere, and the oncologist put me on letrozole. August 2017, my cancer markers had just stayed the same, so I started medicinal cannabis oil. Immediately, my chronic eczema had disappeared, and my arthritis and my sleep had improved. On October 2017, the scans were really good, and my oncologist had said that they were I responded remarkably well to medication. February 2018, I told the oncologist that I had started using the cannabis oil, confided in him. He didn't seem to worry too much. May 2018, my oncologist said my scans were perfect scans. November 2018, my oncologist said to me with amazement that I'd actually had no uptake in my entire body. December 2018, I was approved by the TGA for medicinal cannabis oil. And November 2018, my scans were that good that my oncologist had said no more scans for another year. March 2020, my gyno-oncologist was so pleased with my 5-year progress, he signed me off from him. June the 2nd, I saw my head oncologist and he said, keep taking the letrozole and the medicinal cannabis oil because it's obviously working. August 2020, now I have been on the medicinal cannabis oil for 3 years. In that time, I believe it has helped me with cancer, chronic eczema, arthritis, PTSD, hay fever, neuropathy, pain and numbness in both feet, and healing fractures in my sacrum, and of course sleep. That's kind of my story up to date.
Wow, that's such an amazing story. You've been through a lot. Have there been any side effects from the medicinal cannabis or any downside?
All I can say is everything positive. I can't say anything negative at all. Not one thing. Nothing negative. It's just it keeps amazing me. All the good things it's been doing.
And how have your family and friends been with you taking medicinal cannabis? Have you been any ghosts?
Sorry?
Have you been the brunt of any jokes? Anyone made any?
No, but actually, my mother is on a dementia, and actually one of my daughters, she's just been prescribed as well.
Wow.
To help with anxiety.
There's a really exciting research happening at the moment with dementia and the symptoms of sundown, and we're hoping it can help. So has it helped your mother? Has she been on it that long?
She started back about a year ago, I think it was. We've gone through different ratios and everything. We actually were told to up the ratio by a doctor from Canada. And we tried that, but it seemed to me like we didn't get up to what he'd said even, but it seemed like it was too much. So we pulled that back, and now probably we've pulled it back too much, because now we can see the patterns of behaviour that she had before are coming back. So we're in the process again of trying to up it. But yeah, been hard because I'm dealing with interstate doctors, and we've got one here now in Perth, and yeah.
So what symptoms does it help with your mother?
Well, calmed her down. I mean, we were told like 18 months ago that she was in last stages of dementia and expect her to pass pretty much soon. That was 18 months ago. And they put her in a different section, and then that's when I thought we've got to get her on the oil and stuff. And here it is, all these months later, and she was hitting herself, like, I don't know what you call that, but hitting herself a lot. And doing different things. She was like a complete vegetable at that stage. There was nothing coming out of her, rational. But now we've done the whole circle that, she'll still talk gibberish, but then she'll come out with a complete statement, question to you. And it's relevant at the time.
Wow. Okay.
Yeah, so that's been a bit of a spin out, because before it's like talking to a complete vegetable, now we go there and she can come out and say, she might just say, "You look pretty today." And you're just like, huh? Where'd that come from?
Wow. Yeah, thank you so much for sharing that with us. Yeah, we're hoping to get one story from you. We've got two amazing stories, so thank you very much for your time today. Really appreciate it.
Oh, thank you, Paul. Thank you.
Okay, I'm not sure about everyone else, but I had tears streaming down my face when Shelley was telling her stories, and some amazing stories from all the presenters. So I'm just going to ask them now to unmute and start their video.
We can't.
Should be able to.
Host has stopped.
Yeah, it says the host has stopped it.
Video.
I'll be able to change that. Leave it with me. Let me.
Did you say to turn video on or not?
Here we go. Start the video. That's better.
Not there.
So we're going to get into some Q&A first. And Jason, I've got lots of questions about your audio presentation skills because they walk all over mine. But I've just got a question I want to ask you in front of everyone. And I know the answer to this is how long it took you to get your first medical cannabis prescription, and roughly the cost, because the story of persistence on your part is massive.
Yeah. Look, I won't give you the full story because it goes on for ages. I enjoy telling it, but we haven't got the time. Bottom line is, I was the first MS patient in WA to actually get a prescription for multiple sclerosis, for medical cannabis. And the whole process from the very first time my doctor wanted to prescribe it until I actually had a bottle in my hands took just over 3 months. I think these days, most doctors will be able to prescribe it, and you'll be able to get it in a lot of pharmacies. You could probably do the whole thing same day.
Mm-hmm. Yep. Well, it's certainly gotten a lot easier later. So next question up for Shelley. What dose did you settle on with the oil and frequency?
So we've tried, like I said in my interview, lots of different amounts and times of day and all that, but we've settled on 1.5 mils, which is 150 milligrams once a day. So we just give it to her late afternoon, And if we forget, we have to give it to her a couple of hours after her nighttime meds because it can't be given with her usual anti-epileptics. But yeah, that's the dose that works. It's like that's the miracle dose.
Yeah. And question from Kevin. He's asked, I'll ask this of everyone, has anything being done with regards to driving whilst using medicinal cannabis? I just want to ask the patients if anyone's had experience with cannabis and driving. I might start with you, Anna. Do you drive while you're on medicinal cannabis?
No, I can't because I've got double vision as well. So I haven't been driving for 2.5 years now.
Yeah. And Jason?
Well, look, Paul, the thing is, the TGA actually made me sign a form to say that I wouldn't drive if I'm taking the medical cannabis. Part of the problem is, of course, we don't treat it like alcohol. It's treated that if you've got any THC in your system, you're under the influence and therefore you've committed an offence, which is ridiculous. But I think things will change because we now actually have the technology. They've got breathalyzers now that can actually tell exactly how much THC you've got in your system. So I think with a few more studies and a bit more testing, we will be able to come to a place where you can get away with having a little bit of THC in your system.
Yeah. And Leslie, your experiences with cannabis and driving?
I haven't been driving. Well, I drive just around the corner to my daughter's house, but that's not on any main roads. But yeah, it's just, you don't know how much is in it or whatever, and the rules there.
Excellent. So the next question for Bert from Sachiko. She's asked about the dosage for autism that you've been using, Bert.
Yeah, well, in my experience, we'll probably find that most children will vary. In fact, they'll all vary. So what's good for one won't be good for another. Like, for instance, if you have a child that's quite hyper, it would be different to the dosage that I give to my son. So, from that point of view, when you do start it slowly, and also look at the ratio as well. I was talking about ratios before. We've got a daytime ratio, which is a 10-10 ratio, which is, correct me if I'm wrong, Paul, 10 milligrams of THC, 10 milligrams of CBD. We give him 0.5 ml. That's just daytime. He's allowed up to 1. And we give him 0.5 ml in the morning when he gets up. And that's just so he can operate during the day. Now, we could give him a little bit more, but right now we don't see the need. On a day where we think that, he's not having the best of days or not going to have the best of days for whatever reason, we can see that he's, moody or, not having a perfect day. We might give him more. Hadn't really had to do that too often. Mm-hmm. At night time, we've got him on the 20-5 ratio. So that's 20 milligrams of THC and 5 milligrams of CBD. And we're currently giving him 1 ml about an hour before bed. So we might, fine tune that. We might sort of tweak that a little bit in time. It might be a little bit more. We're being a little bit cautious with it. So we don't want to just give it to him because we can. But for the next child, it might be a child, for instance, that's very hyper. So you probably, I don't know, the 10-10 might not work well. So you might have to give, one that's more, I guess, don't take this as advice, but you might consider giving something that's maybe higher in THC, just so it sort of takes the edge off that, the hyperactivity. So, yeah, but the thing is, there's no such thing as you're going to get it right from day dot. It could take months, a year. I still don't think we've got it perfectly right. I still think we've still got a way to go. Yeah. We might introduce a third ratio. I don't know. One might be, he's got chronic gut pain. We might introduce another ratio for gut pain and that sort of thing. So, everybody is different. Every child's issue.
That's why some of this research coming online is so important, and also speaking to your doctor. Just going to move on from there. Someone's asked a question, can children be prescribed with THC in Australia? I'm going to ask that question of you, Shelley. I know we've had this discussion offline about...
Yeah, no. The answer straight up, no. It's CBD only that's allowed for a prescription in Australia for children. Yeah. And it can only be prescribed by the child's specialist, not a GP. So that's not the rule with children.
Yeah. Let's hope that all changes.
Yes and no. From my point of view, with my daughter's medically fragile, so that's the space that I'm in. So children that are in that space that are looking at cannabis, they're going to need to have someone overseeing that little person's overall health. So, but the issues within that, with the children being only prescribed by specialists, is that the program has to be opened up further, where the adults community, they're able to access it through GPs, which is wonderful, but the kids don't have as much availability to it. Yeah.
So I've just got one final question on costs. I'm going to let each of you have a chance to answer. I'm going to start with you, Jason.
Look, when it comes to the cost of medical cannabis, it's not on the PBS. So, you know, I think I mentioned before I was on 7 daily medications, but they were all subsidised by the PBS. So it was costing me, I don't know, what, $40 a month. Costing the government a lot more because obviously they're subsidising it. So now I'm not on those medications. They're saving a lot of money, but I'm spending more, and I'm spending, you know, in the region of $200 to $250 a month.
Absolutely.
And I'm having to cover that. So there goes the foxtel, there goes my carton of beer, there goes my meat diet, all because I want to try and stay, you know, on this side of being disabled. So I'm a little frustrated at that. And I'm hoping that as we progress now, we get more people using medical cannabis and more people producing it and selling it, that price will be driven down by standard market forces. And hopefully it will eventually go onto the PBS or something similar.
Definitely. And your experience, Bert?
Yeah, so exactly the same. I think if Jason and I were face to face right now, we'd probably have the exact same answer. You know, my son was on 4 or 5 different, you know, chemical drugs, which are all covered by the PBS, and, you know, and would have cost a packet. I know that one of them was really expensive, and that was all covered. So I think it was costing us $6 a packet or whatever the case may be. So, and now it's costing us, 6 weeks is costing us about $400. We're happy with that. What price do we put on our, you know, quality of life, or his quality of life, and then ours, I guess. So we're happy with that. And yeah, like Jason said, might have to have 2 beers less a week. So, but you know, so it's costing us the one heavy and THC costs a little bit more, and the one with you know, the equal amounts of CBD and THC does cost less. But they combined, they're about $400 every 6 weeks, I think. So yeah, and more 5 weeks. So yeah, that's ours.
And Leslie?
Yeah, I'm on a pension, so it's sort of, yeah, it would be good if it's on PBS and that, but I don't really worry about it too much because I'm a stage 4B cancer, as you know, patient, and the cancer had come back everywhere in several places. So as far as I'm concerned, I don't really have much choice, and I'm just been fantastic since I've introduced the cannabis oil. And yeah, it'd be great, you know, on the PBS, but as I said, just no choice whatsoever. I don't even worry about the cost anymore because I believe that the cancer would, I don't think it's cured the cancer, like Jason was saying. I don't look at it as a cure. I look at it as a chronic illness, just like a diabetic needs their insulin, and they stop the insulin, they go into a coma. I believe the same thing with cancer. I believe it keeps it well and truly at bay, but if you stop it, I believe it comes back. So I don't really have any choice with finances because it's, to me, it's a life or no life. That's how I look at it in my situation.
Yeah, yeah.
And Anna, your experience?
I must admit I pay a lot more a month than what I've heard you guys pay. I'm probably on $2,500 a month.
Wow.
Oh, wow.
And I'm at the moment got no money. I have applied for pension, but that's still up in the air. I'm lucky my husband works and we had a bit of savings. We're a bit more on the house and probably will.
And last word tonight, Shelley?
We're very fortunate that through the Children's Hospital, there's a program that we are qualified for under. So yeah, thankfully we've never had to pay. However, I can tell you that when we first started to get it through the hospital, this is like, 3 years ago, it was $725 for 25 meals. So yeah, so over the years, now when we get our bottles, the prices come down to about $230 a bottle. But for our family, that's just not affordable. Both my husband and I both don't work to care for Soph. So if it wasn't covered by the hospital, I don't know how we would be if it wasn't covered by the hospital, Sophie wouldn't able to be on it. So we're very fortunate, and a lot of families in Perth that like I said, that they have a program that they have to meet certain criteria. So there are quite a few children that are under that program, but there's a lot of children that aren't as well. So yeah.
Thank you. So that's all we've got time for tonight. I'd just like to really thank all the participants and the panelists tonight for telling their story. It is so important that you guys can share this with everyone else, and we'll have this up on YouTube to share even further. So please feel free we will share the link with everyone. Please feel free to share it far and wide so even more people know about it. Our next webinar in the series is on cultivation, happening exactly 3 weeks, where we go and visit the plant, and that's quite an exciting one I'm looking forward to as well. But thank you very much, everyone, and good night.
Oh, you're quite welcome to come up to my hotel room if you want. We can see the Opera House.
It's a pretty terrible view there, Jason.
I do need to find out about your AV skills. Thanks, Jace.
Bye.
Bye.
See ya.